Gastroesophageal reflux disease, GORD, also known as GERD in the U.S., is a chronic condition where stomach acid or bile flows back into the esophagus, the tube that connects the mouth to the stomach. This acid reflux irritates the lining of the esophagus, leading to discomfort, inflammation, and a range of symptoms. GORD is more severe than occasional acid reflux and can significantly impact quality of life if not managed. Causes: GORD occurs when the lower esophageal sphincter, a ring of muscle at the bottom of the esophagus, weakens or relaxes abnormally, allowing stomach acid to flow back up into the esophagus. Contributing factors include hiatal hernia, the condition where part of the stomach pushes up through the diaphragm into the chest, weakening the left and allowing acid to reflux. Obesity. Extra abdominal pressure can push stomach contents back into the esophagus. Pregnancy. Hormonal changes and increased abdominal pressure during pregnancy can contribute to GORD. Smoking. Smoking weakens the left and increases acid production, making reflux more likely. Diet. Foods like fatty foods, chocolate, caffeine, alcohol, and spicy foods can trigger or worsen reflux. Certain medications. Medications such as aspirin, ibuprofen, blood pressure medications, and some muscle relaxants can weaken the left or irritate the esophagus. Delayed stomach emptying. If the stomach takes longer to empty, it increases the likelihood of reflux. Symptoms. The severity of symptoms can vary from mild to severe. Common symptoms of GORD include heartburn, a burning sensation in the chest, often after eating or when lying down, which may worsen at night. Regurgitation, a sour or bitter tasting acid backing up into the throat or mouth. Difficulty swallowing. Dysphagia, the feeling that food is stuck in the throat or chest, especially with large or dry pieces. Chest pain, sharp or burning chest pain that can sometimes be mistaken for heart-related issues. Chronic cough or hoarseness. Acid reflux can irritate the throat, leading to coughing or a hoarse voice, particularly in the morning. Lump in the throat sensation. Globus, the feeling of something stuck in the throat, even when nothing is physically there. Nausea. Some people with GORD experience nausea or even vomiting. Worsening symptoms at night. Lying down or bending over can make symptoms worse. Diagnosis. Diagnosing GORD often begins with a physical examination and a review of symptoms. Several tests may be used for further evaluation. Endoscopy. A flexible tube with a camera is inserted down the throat to examine the esophagus and stomach. It helps detect inflammation, ulcers, or complications like Barrett's esophagus. pH monitoring. This test measures the acidity level in the esophagus over a 24-hour period to determine how often acid reflux occurs. Esophageal manometry measures muscle contractions in the esophagus to evaluate the function of the left and the esophagus's ability to move food to the stomach. Barium swallow upper GI series. An X-ray of the esophagus and stomach after swallowing the barium solution that highlights abnormalities in the digestive tract. Treatment for GORD aims to relieve symptoms, heal the esophagus, and prevent complications. The approach may involve lifestyle changes, medications, or surgery. 1. Lifestyle modifications. Diet changes. Avoid trigger foods like spicy foods, fatty foods, caffeine, alcohol, chocolate, and citrus. Eat smaller, more frequent meals rather than large meals. Weight management. Losing excess weight can reduce abdominal pressure and ease reflux symptoms. Quit smoking. Smoking weakens the left and worsens reflux. Elevate the head of the bed. Raising the head of the bed by 6 to 8 inches can help reduce nighttime reflux by keeping acid in the stomach. Avoid lying down after meals. Stay upright for at least 2 to 3 hours after eating to allow food to digest properly. Wear loose clothing. Tight clothing around the abdomen can increase pressure and cause reflux. 2. Medications. Antacids, over-the-counter antacids e.g., Tums, Rolaids can neutralize stomach acid and provide quick relief for mild symptoms. H2 receptor blockers. These medications, e.g., ranitidine, famotidine, reduce stomach acid production and are used for short-term relief for milder symptoms. Proton pump inhibitors, PPIs, e.g., omeprazole, lansoprazole, are more potent and reduce acid production long-term. They are commonly prescribed for more severe cases. Prokinetics. These medications, e.g., metoclopramide, can help speed up stomach emptying and reduce reflux. 3. Surgery. Fundoplication. The most common surgery for GORD, where the upper part of the stomach is wrapped around the left to strengthen it and prevent acid reflux. LINX device. A ring of magnetic beads is placed around the left to prevent reflux while still allowing food to pass into the stomach. Complications. If left untreated, GORD can lead to several complications, including esophagitis, inflammation of the esophagus caused by repeated exposure to stomach acid, leading to pain, ulcers, and bleeding. Strictures. Scar tissue can form in the esophagus due to chronic inflammation, leading to narrowing and difficulty swallowing. Barrett's esophagus. The condition where a lining of the esophagus changes due to prolonged acid exposure, increasing the risk of esophageal cancer. Esophageal cancer. The rare but serious complication, especially in people with Barrett's esophagus. Chronic cough or asthma. GORD can trigger or worsen chronic cough, asthma, or other respiratory problems by irritating the airways with stomach acid. Conclusion. Gastroesophageal reflux disease. GORD is a chronic and sometimes debilitating condition that can significantly impact daily life. While occasional acid reflux is common, persistent symptoms of GORD require medical attention to prevent complications. With lifestyle changes, medications, or surgery, most people can manage GORD effectively. If you experience frequent heartburn or other symptoms, consult a healthcare provider for a proper diagnosis and treatment plan.